Hello, my name is Philomena Goodall and I'm living in the Oxfordshire area. I have been working all my life and recently approached at retirement age. So looking forward to doing all sorts of things in terms of my hobbies. I've been active in archaeology and researching history and things like that. Recently moved to a new town and joined various groups. I was watching television one evening and noticed that I had some visual disturbance in my right eye. I thought initially that this was probably due to having perhaps a headache or something like that, and went to bed. But when I woke up the following morning, I found that my eyesight had deteriorated considerably, and it was like a black veil had come down over my eye. It was very alarming, very distressing and very frightening. I decided that I would go and see the optician as soon as I could. So I went to see him, and he had a quick look at my eyes and said that I had a primary angle closure glaucoma, and this was a condition that I was completely unaware of, and it was really frightening because he said it was very urgent and I needed to go to hospital immediately to have some treatment. My husband drove me to the nearest hospital, which was the Oxford Eye Clinic, and when I went there, I was attended by a team of nurses and doctors who were supervised by Mr. Jutley. I found that although I was being sick and feeling very, very ill and quite poorly, it was very reassuring to have Mr. Jutley there. He was a very calming influence, and I found that having the treatment, it was extended over quite a few hours. The problem was that the eye pressure, I found, had gone right up to something like 81, and the objective of the treatment initially was to try and bring down the eye pressure because that was what was causing the problem. I was aware that had I not gone to hospital and received immediate treatment, I would have lost the sight in my eye that day. So I was extremely grateful to Mr. Jutley and his team for the work that they did. After several hours of treatment and monitoring the situation, a decision was made that they could do some laser surgery on my eyes. They had to treat both eyes because the condition affected both eyes, and although the incident had only involved one eye, the other eye could have had the same thing at another stage. The laser treatment was painless, and I can't say that I suffered in terms of any of the treatment. It wasn't painful, but I found that Mr. Jutley being in the background and explaining what was going on was very reassuring in what was a very, very alarming and distressing situation. I hope that that one can gain confidence from knowing that that can be very reassuring to be in the right hands. And Mr. Jutley's team worked in an excellent and coordinated manner, and I think that reassured me that things were back on track. By the end of the day, and having had this intensive work done on my eye, I found that the eye pressure had come down considerably, and I was feeling much better, and the eye pressure had gone back to normal, something like 14 or 16 in my right eye. So it was very reassuring to find that that had now come back to a normal level. So I felt much happier, and I was no longer being sick. Throughout the time that I was being treated, Mr. Jutley was present, and a very reassuring presence, and I found that he was excellent in the manner in which he dealt with the situation, because it was very frightening. And I think in that type of situation, having someone who is very knowledgeable and experienced and understanding of the patient's problems can make a big difference to the outcome for the patient. After I'd had this initial emergency procedure done, I was asked to come back to the clinic to have a review and to have an eye examination to see how things were, and I went back and that was fine. And at that stage Mr. Jutley explained that I could have an operation done which would enable me to basically not have the worry of this occurring again. It was quite clear that the operation was a complex one, as it involved me having a general anaesthetic, and I would find that it would reassure me that the condition was controlled. He did explain to me in some detail about the problems that could arise. There was a risk, albeit small, that I could lose my eyesight when the operation was done, or there could be other complications about infection and so on. But listening to him, he explained things very clearly, and I felt reassured that the advice he was giving me was of the first calibre, and he was excellent in the way he explained it clearly to me, and I could make a choice about whether I should go ahead with the operation. But I became convinced that it was the right course of action to take, because I was very worried about the possibility that I might have a further occurrence of losing my eyesight, and perhaps I might not have had the good fortune to be near a hospital and be able to receive help from Mr. Jutley. As a result, I felt that I wanted to have the operation done. I then had the operation, which involved a general anaesthetic. I must admit I was apprehensive, as one would be, but when I came round after the operation, Mr. Jutley popped in to see me and said, you know, it's been successful, and you know, just to reassure me that I was okay. And that was really, I felt quite elated. You know, I thought, gosh, this is amazing that this has been achieved. And so I then went into recovery, full recovery from the anaesthetic, and went home that night.